Every time I talk about BDD, I mention suicidality because
Mm.
up to 80% of people with BDD experience suicidal thoughts, and 25% make attempts, which is really
Hmm.
one of the highest in all of our psychiatric conditions.
Welcome to OCD Whisperer podcast. Today with me, I have a special guest, Dr. Sony Khemlani-Patel. She's the clinical director at the Biobehavioral Institute in Great Neck, New York, where she specialized in evidence-based treatment of OCD and related disorders for 25 years, guys. She's on the scientific and clinical advisory board of International OCD Foundation and is the vice president of OCD New York, which is the New York State affiliate of the IOCDF. And Dr. Kamlani has co authored three books, two of which are on BDD. Welcome to the show.
Thank you so much for having me.
Absolutely. It was kind of a godsend. I got you to meet you recently at the Anxiety Depression Association of America conference. And I attended your talk on body dysmorphic disorder. And I thought, oh my gosh, yes, please say yes and come on my show. So I'm so grateful that you're here.
Thank you so much. That was great. We like ran into each other in the hall. I didn't even know you attended. So,
um, So I, as everybody knows, love to kind of dive right in. And the most common thing that I hear people ask is, what is the difference between like body dysmorphic disorder versus an eating disorder versus body image? Would you be able to share with us what is the difference? What is each one? Because I think people often get it confused, as well as often think that I just have maybe some insecurity around my body, but not realizing that it might actually be more towards, body dysmorphia.
absolutely. I think, since COVID too, we've come up with more terms like Zoom dysmorphia,
Ah,
body dysmorphia. And I guess that just suggests that you're unhappy with your appearance, which we know a significant portion of us are do struggle with some part of our bodies at some point in our life, right? We look in the mirror and we say, oh, I have bags under my eyes, or my hair's a little frizzy. So that's not BDD. A high percentage of us struggle with that. The difference really in BDD is that it takes up more than an hour a day, and typically 3 to 8 hours a day of somebody really like ruminating, worrying,
mm,
thinking, having these intrusive thoughts that some part of their appearance is flawed. I hear people say, I look deformed, I look like a monster. So they really struggle day to day.
mm,
And then there's a significant avoidance that goes with it. Because you can imagine if you don't feel good about the way you look to that degree, like you say, you're disgusting. It's very hard to go out, to date, to go to doctor's appointments, to sit in class feeling like people can really see you. So these are people that really struggle day to day, causes interference. They engage in like repetitive behaviors.
hmm
Like mirror checking is the most common.
So how is that different than, let's say, somebody who has an eating disorder?
So that's a little bit more complicated. I answered your first question. It's a much more simpler one. I think as clinicians, researchers are really struggling because there also is an overlap. Like
Mm,
you can have BDD and an eating disorder. It's not
mm,
that if you have one, you can't have the other. There is an overlap between the two conditions. You can be diagnosed with both. The difference with an eating disorder, like anorexia, is probably the one that comes to mind.
hmm
They People with BDD and eating disorders both struggle with body image,
mm,
right? So they look in the mirror and there are these perceptual, like visual differences that they see that we don't see what they see in the mirror, right?
hmm
Typically with BDD, people struggle with their facial features. That's the most common area that they fixate on.
mm,
Their skin, their hair, symmetry. Nose is a big one, right? My
mm,
nose is misshapen. There's a bump. It's crooked. Whereas in eating disorders, anorexia, it's a struggle with feeling overweight, like fat, or
mm,
the fat is accumulated in the stomach area, the thighs. So sometimes it's the difference in what part of the body you're fixate on.
mm.
And I think the most difference is the eating patterns that you see in eating disorders. So somebody with anorexia is really restricting their weight, their food intake to feel
Mhm.
like they can lose weight. Whereas somebody with BDD, is fixated on other parts of their body.
Yeah, so I can also hear like part of the BDD too is that you're perceiving something as deformed and off. And it sounds like it's something that may not be there, or maybe there's something small, or maybe there is something that happened, but perhaps how you're seeing it or how you're interpreting it um, can be really kind of drastic.
Yeah, I mean, people with BDD, we call it a perceived flaw, so people don't see it. They're normal to, above average, very attractive individuals, but they really struggle with that detail focus.
So what would you say is happening in the brain? Because I guess even for me, like some of the things I've learned, and I just wanted to, 'cause, I mean, you're a specialist in this, right? Like, so what is there a biological component here, right? Is it something that somebody's learned just through their environment? Are they faking it? Because sometimes people, have this misnotion thinking, oh, somebody's just kind of for vanity purposes.
Yeah. I mean, BDD's been so misunderstood. We really didn't have good research until the 80s and 90s.
Mm,
So, for anybody listening who has BDD, you are not vain. This is not something you made up. You're not narcissistic.
mm,
It's a real, it's an OCD related disorder, right?
mhm,
So there is some good there's wonderful new biological evidence that came out in the last maybe 20 years that really shows that people with BDD struggle with like a perceptual problem. So it's like their brain is visually perceiving detail in a
mm,
way that if you don't have BDD, you don't do. Um, so it's like losing the context, right?
mm,
So I always give people a bunch of examples. Like imagine you go into a room and you just fixate on one little detail in the room, and there's so much going on, right? The colors, the patterns, the couch, the cushions. But somebody with BDD is like zeroed in on this like one little mini like painting or something in the
mm,
room, or one little aspect of a painting, and you lose the whole context.
mm,
Um, and then when you stare in the mirror for hours every day at this one detail, you definitely lose the holistic
mm.
approach of your entire body.
Got it. So you're literally like visually, kind of your visual center is literally impacted. You're not seeing things, and then this act of hyper focusing on that one piece. I mean, I love that example. Actually, I don't think I've thought of that, but like, yeah, if you walk in the room and you just focus on one detail, let's say on a pillow, you completely zoom out and lose the context of the rest of the room and where are you even and what's
Exactly.
going on.
Exactly. I've had some patients, it's so interesting over the years, who've coincidentally been photographers, right?
Mm,
Amateur photographers. And one day I said, just show me some of your pictures. And they did. And it was like all they did was focus on the detail. I had this one patient like go to this beautiful botanical garden, and like every picture was just zeroed in on the flowers.
huh,
Which we all do, right? You take
sure.
this beautiful flower, but it was like picture after picture. And I said, that's all you focus on. She said, yeah, details.
Got it. That's really interesting, actually. Yeah.
Yeah.
So, I often also hear people say things like, but like, I really, really like people insist that what this flaw really is real. It's not distorted. It's there. Um, how would you address that? Like, what would you say to them?
I think that's the hardest part of engaging someone in treatment with BDD, right? Um, we spend a lot of time on education, right? Getting on the same page so that the client in our office is really on board with what the treatment entails. But explaining the difference between what body image is and what appearance is. So, body image is like our mental representation of what we look like.
Mhm,
And that's cultural factors, right? All these other factors are environmental, perhaps even early teasing, bullying, which there is some research suggesting abuse. So the onset of puberty and your experience with that. So it's a very complicated thing.
mhm,
And you bring all of those to the mirror, basically. So when you look in the mirror, you're not just looking at the way you look, like the color, size, shape of your face and your hair. You're bringing all of that in. And then you're bringing this biological, perceptual experience. So it's like being colorblind is the most like kind of clear example I give to people. You know,
interesting.
like
Yeah,
I
so
know
you
you
said
see.
bowling, and I'm kind of curious, like if we can kind of touch on that for a second. Is there research that says that like kind of trauma happens and BDD is a result of trauma? Because I know often out there in the conversations that on the internet, people say, "Oh, OCD is a result of trauma," and it's like, well, no, not always, but
Not
you
always.
can have both, right? So is BDD a result of trauma, or is it like, yeah, you could have maybe teasing and bullying that is really stressful and unpleasant, and that can kind of start the BDD cycle, but you have a predisposition towards it, or how would you say that works?
Yeah, I mean, I wouldn't see it as a cause. We don't have enough evidence. And I've met many of my clients' patients over the years who have not had a trauma history. So can it be a predisposing factor to BDD? Certainly. Can it be a predisposing factor to depression, to eating disorders, to other things? Also, right? Trauma can create a whole host of conditions, not just BDD. So it's probably one factor, not the only factor.
Got it. Okay, that's interesting. And
Yeah.
so when you're talking about, I know you said, kind of to come back, you said there's the body image, and then you said there was one other thing. So, well, if we can go back to that, what was it?
Sure. The difference between you were saying body image and appearance, like appearance,
Yeah,
just, color, size, shape, and body image is the way we think about our appearance, the way we feel about our appearance, right? How we judge it. So we really try to untangle all those factors, like the cognitive factors, the historical factors, cultural messages, early life experiences. What's so interesting is that some people with BDD aren't necessarily teased about their appearance growing up or told negative. In fact, they had a lot of positive attention
hmm,
placed on their appearance. So it's almost like their identity became, oh, you're so cute, you're so beautiful, I love your hair. And then suddenly that became the thing that they felt other people value in them. And
that's
then they were
interesting.
focused on that too. Um, that's not to say we should stop complimenting our kids because people do. But maybe there's a biological predisposition there to kind of holding on to those messages somehow, along with a whole host of other factors.
So is it fair to say that, like, if somebody has BDD, like when they look in the mirror, like you said, is that they're also carrying kind of this internal story that they have in their head about
Yeah.
whatever the different things they've heard, of course, like whatever in their culture, of course, there's also, I'm sure, certain standards or whatever
Mhm.
the environment has reinforced or not, and kind of all of that is there. So that kind of gets in the way of like seeing what's actually there.
Yeah. And then we think this real visual perceptual experience happening as a result of how the brain perceives detail, right? Over holistic imagery. There's some great fMRI research that shows that people with BDD really visually perceive things differently than the rest of us who don't have.
Interesting. Okay,
Yeah.
so if we understand, then these are all the different pieces that go into what BDD is, body dysmorphic disorder. Kind of, I guess let's shift gears for a second and talk a little bit about what does the person do with this, right? How can they recognize, oh, I think I have this? Because to your point, right, nowadays I think too, a lot of terms get thrown around and people are very quick just to say, oh yeah, like I'm BDD, I'm OCD, I'm this, I'm that, and
Right.
or I have trauma everywhere, and it's like, hold on, we have to slow down for a minute.
Right.
Right. So how can somebody, I guess, two-part question. One is, how can they recognize for themselves that, oh, maybe I am having, body dysmorphic disorder, that's worth to, assess. So that would be my first question, if we can get into that.
Sure. I mean, it's surprising. Some of my patients self-diagnose
Hmm.
themselves. They read about it, they hear about it somewhere. So if you are someone who's thinking about your appearance multiple hours a day, if some people focus on very specific details, right? They zero in on a couple of things. Some people just generally feel unattractive. So it can be this feeling of overall ugliness. So if you're spending hours doing that, if it's leading to interference in your daily functioning, if you can't go out because of it, I will say commonly camouflaging, like wanting to hide the appearance, right?
Mm,
Wearing hats. If you're somebody who's a male who's worried about balding, hair, you're not balding, it's just a, perception of it. If you're wearing baggy clothing, if you're unable to go out unless you do your makeup routine just perfect in the morning. So if you're having a lot of trouble getting out the door in the morning, if you're an adolescent, if you're struggling with school refusal, a lot of kids, surprisingly, they're not doing it because they're truant. They're doing it partly, I mean, for many reasons. It could be OCD, it could be social anxiety, panic, but it also could be BDD. That's
mm,
going back. So there's a lot of social avoidance,
mm,
comparison to other people, to an ideal image of your, what you want to look like. So comparing yourself to others, seeking reassurance from family. Do I look okay? Are you sure I look okay? and then getting very angry because the response you're getting is still not satisfactory, or you're
Mm,
just frustrated. If you're avoiding mirrors, or more typically staring at the mirror and
mm,
any reflective surface in a day, if you're experiencing a lot of shame, depression, suicidality. I always, every time I talk about BDD, I mention suicidality because
mm,
up to 80% of people with BDD experience suicidal thoughts,
that's really high.
and 25% make attempts, which is really
Mm,
one of the highest in our all of our psychiatric conditions.
mm, yeah.
25% make a suicide attempt. And oftentimes they're in the hospital, and the hospital, didn't think to ask, are you thinking about your appearance? Is that what's really making you suicidal? And so it gets missed a lot.
Yeah, and I mean, I bet that, if you're the one dealing with it and you don't even know, you're probably not going to be likely to share some of this stuff, right? Because you don't want to appear like you're being vain about it, but internally you are stressed out because you are experiencing and seeing these things in a completely different way. So, you know, I'm going to assume you're probably not going to tell your doctor right away, or whoever's, asking you questions.
Oftentimes, yeah. I mean, usually I see people come in saying I'm anxious being in social situations,
Mm,
or I'm really depressed, right? And I've been to doctor after doctor, and I'm considered treatment resistant depression. And then I'll just say, well, have you ever thought about your appearance in a negative way? Is there something that you don't like about your appearance? And they'll say yes. I'll say, maybe let's explore that a little bit more, because it could be the BDD that's comorbid with the depression, and that's why you're not finding improvement.
Yeah, I mean, what you're really pointing to is just how important it is to make sure that you have folks who are trained in this and really understand what they're looking for, just like an OCD, right? Because it can get missed so easily. Um, I kind of want to jump to something else that you mentioned that I think is important because I definitely hear this a lot, and I want to touch on this, which is comparison, right? Comparison is a thief of joy. I mean, it's a great quote, but especially now with the internet and all the social media, I mean, the amount of with AI, I mean, we're moving really, really fast with everything in the world. There's no shortage essentially of being bombarded and having access to constantly looking at images. Again, some things, and as AI has gotten better, being able to just recognize, like, wait a minute, is this even a real profile or a real person? With everything looking so perfect. You know, what can somebody do if they're getting stuck in this comparison loop? Mentally checking, mentally even comparing their own old pictures, comparing themselves to pictures online, comparing themselves to, these kind of standards that are, sounds like perhaps unrealistic and kind of extreme.
Yes. I think with AI, right, every image can be perfected in our thing. There was years ago, Dove did this like beauty campaign. I don't know if you even heard of it, where they showed the progression of like a model from when she was home without makeup, with nothing, her hair, and all of the things, not only the makeup, but the way Adobe Photoshop made her
Mhm.
look by the time her photo ended up on a billboard. And that was years ago when our technology wasn't so thing.
Yeah.
So, I mean, what we try to show individuals with BDD is that, when they compare, they're selectively, biasly comparing.
Mm,
So, when you walk into the mall, they're not just staring, they're not looking accurately at everybody per se.
mhm,
They're like zeroing in on people that they feel are more attractive than them.
mm.
Um, so they selectively bias
Got it.
what
So that
they look
cherry
at.
picking process is what you basically want to teach them to recognize and say, hold on. And so what do they do with that? Let's say they recognize it. Okay, I am doing that, but how do I stop? What if they like, I can't stop. I have a hard time stopping. How do I let that go?
Yeah, I mean, I think we talk about how that brings up a lot of their own insecurity and how that's not helping. And, you know, if you were to compare yourself and your wealth, there's always people who have more money than you and less money than you. It depends on what your values are. So that's something we try to do, is really like get underneath the suffering that's going along with it, the insecurity it brings up, um, the value system that gets lost somewhere, where appearance kind of takes up so much of their value and their identity and their self-worth, um, and what comparison really does for that.
Mm,
Erodes
got
all.
it. So in your experience with treating BDD, what would you say is kind of the best approach in terms of, if folks are listening right now and they're like, man, I think this is something I'm dealing with. What therapy would you say that you'd recommend that they go and get, like talk therapy? gonna probably assume no. So
No,
what
I
therapy would you say is the best?
we have really good evidence that cognitive behavioral therapy works. Exposure and response prevention works, similar to OCD, but also very different. There has to be a lot of adjustments done in how CBT and ERP are done for BDD. It has to be done much more gradually. It has to be done with this element of understanding shame, self-disgust. So that there's some really good treatment. There's perceptual retraining, mirror retraining, where you learn to look at your whole body holistically. As I mentioned, people with BDD look at
Mm-hmm.
detail, right? So we bring a full length mirror into the room, and we work slowly on non-judgmentally describing their body head to toe, removing the language of, oh, my hair's frizzy, my nose looks awful today, oh, look at those bags, to saying like, I have shoulder length dark black hair. My eyes are almond shape. My nose is about 2 inches long. So we work on like retraining them and
Mm-hmm.
how they speak to themselves in front of the mirror. And then certainly the SSRIs, the similar to OCD, right? The serotonin, selective serotonin reuptake inhibitors,
Mm-hmm.
be very helpful for people who find the CBT may not be effective. And certainly, if you're struggling with suicidality, we would always suggest a referral to an expert.
Got
Um,
it. And so if the shame comes up, because I know people typically struggle a lot, of course, with heavy feelings, right? Heavy hitters like guilt and shame are kind of tend to be really big ones. What would you say? How does that get addressed in doing CBT for that?
What's been great is that compassion focused therapy we've
Mm,
been adding in
I love it.
dialectical behavior therapy, mindfulness, compassion focused therapy has been a great addition,
I
I
love
think.
it. Yeah, isn't it amazing how like intensely self-critical humans can be and how much humans can tear themselves apart and
Yes,
kind of like we can be kind to somebody else, but we can't always apply it to ourselves.
exactly. So Kristen Neff's workbook, things like that, and Paul Gilbert has actually Paul Gilbert did a talk many years ago at the BDD Foundation. I think it was in England, and that's still available on YouTube on applying compassion focused therapy to BDD. So I would say it's a package, right? After the person gets in feeling better with their symptoms, we really work on getting them reintegrated into life. We want to go after that quality of life component because they might have missed many years of socializing, dating, working
Yeah,
because of their BDD. So we also want to work on that kind of part two of treatment.
I love it. Thank you so much for sharing that resource. I think that'll be really helpful for folks. And just in general, I just want to again thank you so much for coming on the show and talking about this topic. I mean, it's a big topic, but I love hearing that there are strategies and the kind of multimodal approach, to help somebody get better. So yeah, thank you for coming on. And if somebody wants to find you, how can they find you?
Thank you so much. This was wonderful. They can find me just at www.biobehaviораlinstitute.com.
Awesome. All right. I will see you hopefully in the next one.
Thank you so much, Christina. Bye bye.